Hello everyone, I am going to speak about Coxiella burnetii. General characteristics of Coxiella burnetii. Gram classification, gram negative bacteria, shape, rod shape, arrangement, rod shaped bacteria closely related to Rickettsia. Rickettsia is a collection of obligately intracellular gram negative bacteria found in ticks and lice. Motility non-motile. Capsule endospores is absent. Respiration aerobic and facultative anaerobic. Aerobic is a bacteria hair that can grow and live when oxygen is present. Facultative anaerobic is an organism that makes ATP by aerobic respiration if oxygen is present, but is capable of switching to fermentation if your oxygen is level is absent. Optimum temperature 37 degrees Celsius. Optimum pH 4.5 to 5.5. Habitat Coxiella burnetii first identified in pathogens sheep, goats, and cow and wild animals and some birds. Coxiella burnetii is the agent of Q fever. Zoonosis. Zoonosis is a animal to human transmitted in pathogenic disease. First described in Australia in 1937. Disease transmission. People get infected by breathing in dust that has been contaminated by infected animal feces, urine, milk, products that contain Coxiella burnetii. Direct contact, example touching, being linked with an animal is not required to become sick with Q fever. Incubation period 2 to 3 weeks. Incubation period is the time period between exposed to a pathogen and the first symptoms appearing in the host. Virulence factor. Virulence factor. Due to age, infectivity, and disease severity, the pathogen is considered a risk group of 3 organisms. Full-length lipopolysaccharides is required for full virulence and disease by Coxiella burnetii and is the only virulence factor currently defined by infected of an immunocompetent animals. Virulence factors is Coxiella burnetii, phagolysosome and lipopolysaccharides. Pathogenesis. Coxiella burnetii is an intracellular bacterium that causes acute and chronic Q fever. This is unique pathogen has been historically challenging to study due to obstacles in genetically manipulating the organism and the inability of small animals models to full mimic human Q fever. The pathogenesis Coxiella burnetii infects and localized within the cells of the mononuclear phagocyte systems affected entering the host. The bacterium is found within the phagolysosome. Host cells amplified the bacterium. Phagolysosomes is ability to evident into the immune system and establish persistent infections. Liver, lungs, and spleen was damaged, and endothelium system was affected. Clinical disease caused by Coxiella burnetii. Febrile illness. Fever usually accompanied by a headache that plateaus in 2 to 4 days and returns to normal in 5 to 14 days is the most common outcome of the infection. The fever lasts longer in untreated patients up to 57 days and in healthier patients. Atypically pneumonia, it is characterized by non-productive cough, fever and minimal and osculatory findings with non-specific findings on a chest X-ray. Hepatitis. It may present in 3 waves, including hepatitis without clinical manifestation, hepatitis with hepatomegaly, and hepatitis with granulomas and liver biopsy. Presenting as a prolonged fever of unknown origin, those patients develop fever, abdominal pain, nausea, vomiting, diarrhea, and anorexia. Cardiac involvement. myocarditis and pericarditis are seen in some of the patients with Q fever. Myocarditis is one of the major causes of death in those patients. Xanthoma associated with fever, though uncommon, a pink macular or papular rise may be seen on the trunk in 5% to 21% of patients. Neurological involvement. Q fever may cause encephalitis and monoencephalitis, lymphocytic meningitis, and peripheral neuropathy. The affected for the Coxiella burnetii pathogenesis. General symptoms for Coxiella burnetii: fever, chills or sweats, fatigue, headache, muscle aches, nausea, vomiting or diarrhea, chest pain, stomach pain, weight loss, non-productive courage. Symptoms can be mild or severe. People who developed severe disease may experience infections of the lungs, pneumonia, or liver, hepatitis. Women who are infected during pregnancy may be at risk for miscarriage, stillbirth, preterm and delivery, or low infant birth weight. Laboratory diagnosis of Coxiella burnetii: microscopic examination, gram staining, gram negative short road motility test, non-motile, endospore staining. Coxiella burnetii is gram negative, meaning that it is cell wall as a thin peptidoglycan layer, so it cannot retain a stain called crystal violet stain. Stain pink with saffron dye used drying gram staining, so it is look like a little pink rod under the microscope. Colony morphology on culture medium: nutrient agar grow in semi-solid nutrient agar within 10% rabbit serum and 0.5 hb. Growth is slow, takes about 10 days. Blood agar colonies are white or grey white on non-hemolytic 2 to 4 millimeter in diameter. Mechanic agar only grows gram-negative bacteria, and those bacteria will appear differently based on their lactose fermenting ability. Culture medium: Coxiella burnetii as an obligate intracellular pathogen. Coxiella burnetii has been difficult to culture, making the bacterium difficult to study. Biochemical test: Cateris test is positive, oxidase test positive, urease test negative, indole test positive, MR test negative, VP test positive, citrate utilization test negative, night reduction test positive, casinitis test positive. Sometimes biochemical test was Coxiella burnetii. It is challenging to culture and study through a traditional biochemical test. It is does not undergoing topical metabolic activities observed in free living bacteria. Treatment of Coxiella burnetii: acute infection can be treated with a short course of dioxycycline, but persistent focalized infections require long-term therapy with dioxycycline plus hydrochloroquine, and surgical resections of infected vascular tissue or prosthetic materials may also be required. Children: dioxycycline 100 mg day for 10 to 14 days, trimethoprim and sulfamethoxazoles 8 to 12 mg per day. Adults: dioxycycline, fluoroquinones and monoclonals, and tryptomethoprim and sulfamethoxazoles, and treated for adults. And pregnant women: tryptomethoprim and sulfamethoxazole, and treated in 320 mg to 1600 mg until the end of the 7 month. Prevention and control: reduce your risk of getting Q fever by avoiding contact with animals, especially wild animals are giving birth. Animals can be infected with Coxiella burnetii and appear healthy. Do not consume raw milk or raw milk products. Good personal hygiene: prefer hand wash, avoid animals contact. Thank you.